고민했어요 모두 보고 싶었어 이건 고익은 언제나 너에게 고익
Good morning. How may I help you today?
Yes, doctor. We've been married for years, but we still have a child.
So it's been years since you have you met another doctor before?
No, this is actually our first time.
I understand the condition of you. Now let's take a look at the explanation.
Let's talk about infertility. It's like that unexpected roadblock on the journey to parenthood. Imagine a puzzle missing a crucial piece. It can feel like that when starting a family. Infertility is not just a woman issue. It affects both partners. Sometimes it's a matter of timing, biology, or unforeseen health factor. But here's the thing. It's more common than you might think. The term of infertility refers to the inability of a couple to conceive after a year of unprotected intercourse. Let's uncover ovulation. It's like the nature's special signal for the body to get ready for a possible baby. In a nutshell, ovulation is when a woman ovary releases an egg. It's like the grand opening of a monthly fertility window. According to CDC, ovulation is a phase in the menstrual cycle when ovary release an egg, which called ovum, and travel to the fallopian tube, wait for fertilization by sperm.
How to identify ovulation? People often use methods such as tracking their menstrual cycle and also some ways to identify the ovulation, such as fertile cervix because positive ovulation test result and increase in sexual desire. And ovulation. An ovulation happens when an ovum does not release from your ovary during your menstrual cycle. And ovulation causes hypothalamus and pituitary gland dysfunction. Low level of FSH prevent the follicle to develop, and low level of LH prevent the ovulation.
That is because women with PCOS are unlikely to ovulate because the follicle get arrested by a condition called hyperandrogenism. Instead of growing to the graphia follicle, the follicle will remain and not being ovulated. Primary ovarian insufficiency occurs when the ovaries stop working as they should before age 40. When this happens, the ovary don't make the typical amount of the hormone estrogen or release egg regularly. Means that people with this condition are infertile due to lack of hormone estrogen needed for follicle development in ovary.
One of the factors that contributes to male infertility is varicocele. A varicocele is a common disorder that enlarges the veins in your scrotum. It is possible that the temperature inside your scrotum builds up in the veins. The higher temperature affecting both testicles may affect sperm count or production. Next, we have azoospermia. Azoospermia is a condition where you have no measurable sperm in your ejaculate. Typically, testicles produce sperm. If you have azoospermia, you may have semen, but there is no sperm in it. Oligospermia is not actually that different from azoospermia, except oligospermia is a term that means you have low sperm count. You have fewer than 15 million sperm in 1 millimeter of semen. A low sperm count will result a low chance of fertilization.
Some of the causes of azoospermia and oligospermia are blockages in the epididymis. These blockages occur due to trauma or testicular injuries. It could also be due to epididymitis and cyst or growth. Aside from blockages and genetic conditions, chemical exposure also causes this disease. Exposure to chemical or radiation or prolonged heat can affect sperm production and morphology. It can also cause sperm abnormalities.
The next part, we are going to talk about the treatment. As you know, in our body, there are a lot of hormones that play important roles regarding reproduction and fertility. For example, FSH, LH, progesterone, estrogen, and others. This hormone is very important for our body. In these cases, if follicle stimulating hormone are too low, the doctor might prescribe the patient with folitropin alpha. For people that have low LH hormone or luteinizing hormone, there are two ways to treat, which is estrogen replacement therapy and gonadotropin treatment. Healthy diet and lifestyle are very important to ensure that our body gets the nutrient and sufficient nutrient for our body. When we are talking about infertility, people that develop polycystic ovarian syndrome PCOS or PCOS need to follow a strict diet prescribed by the doctor. Now, talking about curing infertility in men, the important one is the intake of vitamin C and vitamin E. The second one is avoid chemicals such as smoking, vaping. The third one is hormone treatment. Now, another treatment that is famous worldwide and famous even in Malaysia is IVF or in vitro fertilization.
In conclusion, infertility is a complex issue that requires comprehension and individualized approach from both male and female. These modern technologies and advancement in medical science can offer hope for many individuals and couples facing infertility. However, they will also need to seek guidance from professionals and support that is crucial to navigate the journey of fertility treatment.